I want to bring in Dr. Michael Warner. He's the medical director of critical care at Michael Garron Hospital, and he joins us from Toronto. First off, I really appreciate your time. I know how busy you and all the frontline workers are, and we want to thank you for that. I want to start by getting your reaction to the Prime Minister's announcement this morning that he supports ramping up production of medical supplies. What do you think of that?
So I think that's an important announcement by the Prime Minister. There are a number of things that we need in the hospital to care for patients. So we do need ventilators, we need general medical supplies, but most importantly, we need personal protective equipment. That's the equipment that doctors, nurses, respiratory therapists, and other workers wear when they're treating patients with COVID-19, and in particular the N95 mask, which is what I wear when I put a breathing tube in someone's lungs. Without that equipment, we can't provide care to patients, so it's encouraging to hear that production will be ramped up. Hopefully we can get distribution done quickly.
So are you saying right now there's a lack of this equipment?
I can say that there's a foreseeable lack of this equipment. What I mean by that is at current use rates, based on what we're expecting to happen, we will definitively run out of personal protective equipment.
Do you know when that could potentially happen?
I think it varies by hospital because there isn't an equal distribution of personal protective equipment among hospitals, but each hospital has an inventory. It also depends on how many patients they get with COVID-19, but I can say that we will definitely run out of personal protective equipment based on current inventory levels.
We heard earlier from Saskatchewan Premier Scott Moe, and what he's saying, he's putting in mandatory rules now, saying bars have to close, casinos have to close, restaurants have to close, no gatherings larger than a certain number of people, and it's mandatory that there can be fines if these rules are not abided by. Do you think this needs to happen right across the country?
This needs to happen coast to coast to coast immediately. To me, that's what true leadership is, anticipating what's going to happen and making difficult decisions to protect Canadians. COVID-19 does not stop at borders between provinces, which is why this needs to be done nationally. We will get there eventually. There will be a national lockdown. I foresee that. I think there's going to be a lockdown in North America, to be honest. And if we do it sooner, the long-term pain will be less. Every day that passes where we don't do this, where people continue to not abide by social distancing because the guidelines are completely unclear among jurisdictions, is more opportunity for COVID-19 to spread among people. So I'm encouraged by what's happened in Saskatchewan, and I hope that other provinces and the federal government will fall in check.
Do you think the Prime Minister needs to make this decision now or days ago?
Yes. I think the Prime Minister has a lot of things to weigh, including the economic and social implications of decisions that he makes. If I focused exclusively on healthcare, which is my area, then absolutely, this decision was best to be made earlier. But there are a lot of things to consider. But social distancing, mandatory social distancing, clear guidelines on what that means, no opportunities for people to gather in groups of, say, less than 50, because that doesn't make sense to me. That's what we needed a while ago to reduce the spread of COVID-19. I don't think it's too late to institute those rules, but time is running out.
What happens if that doesn't occur?
So what we want to avoid is a situation like Italy, or New York City, or San Francisco, or Seattle, where we're seeing exponential spread of COVID-19. It's a concept similar to compound interest, where patients infect more patients. If that happens, then we'll have a deluge of patients coming to hospitals in Canada all at the same time. And there's no system on earth that can handle that. And what we've seen in Italy is that with all those patients coming at once, not only are patients with COVID-19 not getting treatment, but patients who come in with other illnesses, overdoses, trauma, people requiring emergency procedures, we may not get them either. So the collateral damage of not flattening the curve is actually horrific when you think about it.
What do you see this looking like in a month, maybe 2 months from now?
Well, we're planning for all scenarios. In healthcare, we definitely plan for the worst case scenario. We hope for the best, but we plan for the worst. And that's what I'd like to see from the government. I think we need to overreact if that's what people think we're doing. We need to plan for the worst in every way. We need to make sure that we have enough supplies, enough ventilators, enough beds, enough nurses, enough doctors. We need to make difficult economic and social decisions today that in retrospect may seem completely obvious that they should have been made earlier. So I'm concerned. I am concerned.
What would be the worst case scenario?
I think the worst case scenario, for me personally as a physician, is to be in a position where I have a patient in front of me who I can't help, who I'd normally be able to help or save today. I think that's an experience that Canadians and Canadian physicians and nurses and other healthcare practitioners have never had to face. I'm concerned for my own family. I'm concerned for my friends. COVID-19 will touch everybody. There will come a point in this outbreak where everyone will know somebody who has COVID-19. And, I hope that people are listening and watching and listening to me when I say that social distancing is the most important thing you can do today to reduce the risk of you and anyone you care about, and even people you don't even know, from getting COVID-19. It's the only